Yes, today we are going to see about occupational hazards. So, occupational health. First, we are going to see occupational health. Occupational health should aim at the promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupation. The prevention among workers of the departures from health caused by their working conditions. The protection of workers in their company from risk resulting from factors adverse to health. The placing and maintenance of the worker is an occupational environment adapted to his physiological and psychological equipments. And to summarize, the adaptation of work to man and of each man to his job. So, occupational hazards. So, what is occupational hazards? The types there are. The industrial workers may be exposed to 5 types of occupational hazards depending upon his occupations. So, the first one is physical hazards, second chemical hazard, and biological hazard, mechanical hazard, and the last one is psychosocial hazard. So, physical hazards may happen by heat and cold. The direct effect of heat exposures are burns, bumps, heat exertions, heat stroke, and heat cramps. Important hazards associated with cold work are chilblains, erythrocyanosis, immersion food, frostbite as a result of cutaneous vasoconstriction. So the second one is light. The workers may be exposed to the risk of poor illuminations or excessive brightness. The acute effect of poor illuminations are eye strain, headache, eye pain, lacrimations, congestions around the cornea, and eye fatigues. So these are the acute effects of the poor illumination, and it has to be prevented. So the main chronic effects of the health include minus nystagmus, exposure to excessive brightness or glare is associated with discomfort, annoyance, and visual fatigue. Noise. So like the noise pollution, noise is also making a health hazard in many industries. The effects of noise are 2 types: auditory effect, which consists of temporary or permanent hearing loss. So the company should give headphones or noise cancelling headphones to prevent this. And the non-auditory effects, which consist of nervousness, fatigue, interference with communication by speech, decreased efficiency, and annoyance. It will annoy everyone. Fourth one is vibration. Vibration, especially in the frequency range 10 to 500 Hz, may be encoded in work with pneumatic tools such as drills and hammers. Vibration usually affects the hands and arms. After some months or years of exposure, the fine blood vessels of the fingers may become increasingly sensitive to spasm. The vibration will affect the hand and arms. It will in this continuous form. It is continuous for months or years. And the blood vessels in the fingers may be increased, and it will cause a spasm. It also known as white fingers. Ultraviolet radiation. Occupational exposure to ultraviolet radiation occurs mainly in the arc welding. Such radiations mainly affect the eyes, causing intense conjunctivitis and keratitis. So UV rays are very hazardous. So ionizing radiation. Ionizing radiation is finding increasing application in medicine and industry. Example: X-rays and radioactive isotopes. The radiation hazards comprise genetic changes, malformation, cancer, leukemia, depilation, ulceration, sterility, and in extreme cause death. So ionizing radiation is very very risky. So there is hardly any industries which does not make use of chemicals. The chemical hazards are on the increase with the introduction of newer and complex chemicals. Chemical agents act in 3 ways: local action, inhalation, and ingestion.